Welcome, everyone, to this episode of a 5-part series of the Sunflower Palliative Care podcast. This is a collaboration between the Sunflower Children's Network and Canada's Pediatric Palliative Care Alliance. The series explores issues for equity-deserving groups in palliative care, including vulnerably housed and homeless communities, Indigenous communities, disabled communities, diverse sociolinguistic communities, and Two-Spirit LGBTQ communities. I am one of your hosts, Rachel Neufeld, nurse practitioner with Canuck Place Children's Hospice in Vancouver, Canada. Today, I'm speaking with Dr. Ripu Minhas, pronouns he, him, a developmental pediatrician at St. Michael's Hospital, Unity Health, Toronto, and is an Associate Professor of Pediatrics. He is the Director of Research for the Department of Pediatrics, St. Michael's Hospital, and founder of Our Kids Health Network, a community-led, social media-based child health promotion program that delivers evidence-based health information online for families with diverse cultural linguistic identities. Dr. Minhas focuses on the use of community-based participatory research methods to engage with communities to co-design and deliver interventions to support parents and caregivers from marginalized communities in supporting their children's developmental potential. Thank you so much for being here, Dr. Minhas. I'm really excited to talk to you about this topic.
Oh, thanks so much for having me. I'm excited to be here.
I would love to hear in your words, if you can tell us just a little bit about who you are and what the work that you do and how you got into this world.
Yeah, absolutely. Thank you. And my name is Ripu Minhas. My pronouns are he and him. So clinically, I work as a developmental pediatrician. So I see children and youth and their families when there's concerns around how they're doing with meeting developmental milestones, or if there's concerns for potential for disability as well. So I help families by listening, by going through standardized assessments and trying to understand and help them understand a little bit more about how their child sees the world, how they participate in the world and community around them, and if there are ways that seem neurodivergent or different from what we would typically expect. Seeing, is there a specific diagnosis or name that we give to that? And more importantly, are there interventions or supports that we can put into place and strategies for the grownups around them to help them with maximizing their developmental potential? I think I've always been interested in this area, but maybe didn't know it existed as a profession. So I think early on, I was very interested in how children and youth grow and develop and differentiate and kind of reach to a place where they figure out, where they fit into the community around them. And I was always fascinated by the factors that impact those trajectories. And so particularly during my training in pediatrics, I became very interested in early childhood experiences and also different pathways in how diverse families participated in our healthcare system as well. And so I think all of these things came together to lead to this curiosity and interest, and later this, fire for advocacy, really to try to figure out how we could support people who are left behind by the healthcare system as it currently exists. Because I think really all families have the right to access the resources they need to support their child's maximal developmental potential. And so I think that's what's led me to where I am right now. So at St. Michael's Hospital at Unity Health Toronto, I get to work with families in Toronto's downtown core, many of whom have encountered adversity in different ways, or who have different parts of their identity and different axes of themselves and their identity that have led to them being marginalized, having difficulty in accessing that optimal care. And so sometimes that's related to caregiver mental health, immigration status, cultural, linguistic, or racial identity, poverty, caregiver mental health. It could be a range of different things. And so I do outreach clinics in Toronto in some of our school-based clinics, and also with some of our early childhood centers and family health teams as well. So that's a little bit about my clinical work that I get to do.
Okay, so you're a pediatrician trained provider that's now working with children that have a lot of medical complexities, specifically around development, but that's clearly then led you to identify a pretty significant need. And so you did talk a little bit about identifying different barriers, different inequities to access. And particularly here in Canada, where we want to see everyone have equitable access to healthcare, you've sort of identified a little bit of your work in helping identify, hey, there is this need. What are maybe some of the other barriers? You mentioned a few different groups of people that you've seen have some barriers, but what are some of the other barriers that you're seeing to access the kind of pediatric care that these families need?
Yeah, I think there is, I think there are so many different barriers that we encounter. And then on top of that, then there's the intersection of those barriers as well with some families where some of these barriers seem to kind of cluster. And so with the families that I see, a lot of it is around their socioeconomic status or being impacted by poverty, more specifically, their cultural linguistic identity and having language proficiency to be able to navigate within the healthcare system. Also, a lot around caregiver or family kind of mental health as well. And so we know that some of these things do travel together, where there may be interplay and synergy, where some of these things then can be worse for families. And so being able to access diagnosis, being able to access information to guide how they participated in the healthcare system, which I want to talk lots more about, really takes a toll. And you start to see some of those paths start to diverge for families in terms of how they participated in the healthcare system. And also, truthfully, what we really care about is how well their children do in terms of their long-term well-being as well.
Right. So, there's definitely financial and poverty that impacts access to various things. And we actually touched a little bit about that in our first episode about some of the vulnerably housed population and how that impacts access to palliative care specifically. But can you speak a little bit more about how language and culture, and maybe for like newcomers that don't know our system and then also have language and culture differences, how that worsens the barriers to access? Can you tell me a little bit more about what you've seen and experienced?
I think from that in particular, I'd like to focus on, I think there's language barriers, right?
Mhm.
There's, someone who may not understand the words that a clinician is using, but then there's more than that. Even if you have a translator present to be able to overcome that, just the language piece, there's also differences in the cultural nuances of how communication is done. The fact
Mhm.
that many words that we may use in an Anglophone clinical setting don't exist or translate directly to another language. So, for example, I see a lot of kids with concerns for possible autism spectrum disorder, and many languages don't have their own unique word for autism. And likewise, I think if we're thinking about with palliative care and the nuances of some of the conversations we'd be having related to that. So some of that gets lost in translation,
Definitely.
and that's a funny term to use, but part of it is there's just the nuances there. There's the cultural resonance and adaptability piece that's really important there. I think another level to really think about that we hear about from the families that I work with is also around trust. And
Mhm.
so many of our families are participating in a healthcare system that wasn't really made for them in the first place.
Yeah.
And they feel that when the communications that we have with them are in English or in French, where it is, a little bit of an extra step or sometimes a hassle to get that translator set up or to have those services available for them. So they're participating in a system where they already feel like an outsider, particularly if they're a newcomer. And then we also know that many families may come into our healthcare system with their own sorts of thoughts or preconceived sort of ideas about the healthcare system, having different ideas of what health and wellness or development or end of life care, whatever sort of concept you want to talk about may look like or what experiences they've had in the past. We have lots of families who say, in our country of origin, we had a strained relationship with institutions such as government. And
Right.
here, healthcare is an extension of government by virtue of how we provide care in Canada. And so sometimes there's mistrust there with people that are seen as being in places of authority. And so I think that makes it tricky and particularly really important for us to be aware and intentional about our interactions with families, thinking about, beyond just the language piece, but also how do we create a healthcare system and make people feel that they're a part of a healthcare system that includes them and honors their priorities and their beliefs and values as well.
Yeah, and I think there's a couple pieces that really hit home too for our podcast listeners, and the work that we do with Two Worlds in other countries too is that when we're trying to teach children's palliative care, we realize that our English words, particularly in frameworks, and so as you identify, whatever kind of topic you're trying to discuss, that some things just don't translate with words, but also with concepts. So I'm also hearing too the difference in understanding of health, understanding medical issues, and understanding how the healthcare system helps or doesn't help, or preconceived notions about that can seriously impact willingness to engage and also ability to engage in our healthcare system. I'm curious about how we might consider, like when we are thinking about this. I think you're right in terms of it's one thing to have a translator, but how are we thinking through a little bit more layered, a little bit more nuanced in how we approach families like this? So, in your experience, what have you found to be helpful? And maybe are there things you found to be harmful, things that we need to be aware of in how we are approaching these families?
Yeah, so I think, some important considerations that we've learned. So, as you mentioned, I lead this program called the Our Kids Health Network. And with that, we have been working really hard to leverage social media, which is a place where, many of the families that we work with live, right? They spend a lot of time there. And that's where a lot of families are accessing information. We learned that especially early on in the pandemic, when our in-person services were closed, but the internet, of course, was open. And so there was lots of information there, whether we were talking about COVID or other things. But just thinking again about, can we be where families are, where they're accessing information and trying to understand that. And I think with that, some of the barriers we really understood around how families take in health information has been that there are important differences with how different families take in health information. And some of that is very closely tied to how they then access care and whether they access care. We also know that there's so much misinformation and disinformation that's rampant right now. And I think with increasing sort of momentum, and I think that's something that's always existed in person, but online in particular has become such a tricky landscape. And understanding that mis and disinformation exists in every language and every platform, and yet most of our evidence-based resources that exist are in our official languages. Yeah. So we're kind of widening some informational health equity gaps there as a part of it as well, where we're not doing the same fact-finding and fact-checking and myth-busting in other platforms and languages. And also, as I was saying earlier, many of our communities, and I'm thinking particularly of BIPOC communities, Black, Indigenous, and person of color communities, have a mistrust of healthcare institutions, which relates to really painful histories that include things like colonization, exploitation, enslavement, genocide, and ongoing marginalization as well. So I think these are all things that are important for us to keep in mind when we're sharing information with families and counseling them, that there's a lot that's coming into these interactions that we're having with our patients and clients, and that there are these extra layers to consider of complexity around that. And with that, keeping in mind that priorities might be different, and it's really important to take a good listen, including around, what notions or thoughts and goals families may be coming into our conversations with, and how they may not necessarily align at first with what we as clinicians may think we want to talk about.
Yeah, I think that's such a good point. And it, again, is making me think about in the pediatric palliative care world, how incredibly important it is to gain information about what their understanding of their child's health condition is. And something that I have learned how to be very cognizant of. And one of the first things I do when I meet families, if I'm doing a more formal conversation with them, and we teach in terms of providing particular sorts of conversations, is what is their understanding and what are their values as a family, because it helps us make recommendations or make plans to try and align with values. And it provides us, I think, a huge amount of information when we hear in their own words what they understand. And the other side of shared care planning with families with children that have serious illness and medical complexity is around who do they make decisions with? Who are the important people in their world that help them make decisions around their child's health? Because that also, I think, fits into this picture that you're painting for us of they may have people of maybe religious faith that are person of power in their world, or they might have certain family members that come from a particular belief system or cultural system, or different things that impact their understanding of health conditions and also how they make decisions about that. So I think it's also really important to explore who helps you make decisions, who are your support people. And that helps us to, I think, learn a little bit more about where they get their information from. When you talk about misinformation, disinformation, but also like who are the people that are in their worlds that help them and support them in making decisions about their children. I'm curious a little bit about what you've noticed of how this impacts the child's health in particular before we get into the details of your research and your network that you've built. What have you noticed or seen how the barriers impact the child's health in particular?
The mistrust, the mis and disinformation, these sorts of factors, the risk really is missing care or having delayed care, that particularly when something's time sensitive. And so within my clinical world, that could be something like early childhood interventions, like therapies for speech delay, for autism, for global developmental delay, where we know brain architecture is quickly solidifying in those early years,
Right.
where if there is a delay in accessing diagnosis and then eventually intervention, that could really have long-term impact. And so those delays and misses in understanding and intervening, I think, is one of the big worries when something's time sensitive like that. And of course, this could be applied to any subspecialty or space within health.
Yeah, I mean, there's lots of things we think about with pediatric health that can be very time sensitive. So yeah, easily extrapolated into palliative care too, where we see children with delayed diagnosis that results in an inability to maybe cure, which results in a different approach to care, things like that too. So I see how that fits into children's palliative care world too. So tell me a little bit about your research then and the lead into our kids' health. Tell me a little bit more about what that is and how it's been helpful.
I think, with all of those things I was mentioning earlier, with this idea of, the online informational landscape being so fraught right now with, and I'll say dangerous, but also with the fact that we've got families with children and youth at home that are accessing information online that is, not necessarily vetted, may be biased, may have kind of different motives behind it, including to, sell products. There's lots of different things online that I think can be attractive or engaging for families, where it starts off maybe as entertainment, but then also will share other sorts of things that could cause harm, could cause delay in accessing evidence-based care. And that was something that we saw early on during the pandemic, where in particular around COVID-related measures and then eventually with vaccine uptake as well, that there were these gaps and a lot of finger pointing happening towards BIPOC communities for being so-called hotspots for COVID, and then later for being delayed in terms of having uptake of vaccines. And it really reminded us of all of these things, really, that, diverse communities participate in the healthcare system in different ways. They take in information in different ways, that a one size fits all approach does not work. I think a quote that really spends a lot of time in my head is that it's not people who fail, but it's systems that fail.
Right.
Right? So it's not people who fail, it's systems that fail. And that's what we really need to be looking at. And I think when we take a bigger look at how people take in health information, who's vulnerable to misinformation as well. And I think that's an important thing to kind of pause and think about. There's a vulnerability there, right? It's not a personality flaw, but again, it's a systems issue. And there are certain factors there as well that without addressing those things head on, we're at risk of widening those health inequities, where people who, speak the primary language, have a higher education system, have the resources to navigate, or the personal kind of characteristics to be able to advocate and navigate the system as well, will tend to do better and access that care, including, whatever is cutting edge or is harder to be able to access within the system, but maybe leading to better healthcare outcomes compared to people who don't have those same sort of characteristics. And so information itself is being seen more and more as being a driver of health inequity and access to that information. And that's really why we created Our Kids Health. So initially we launched our first chapter, which was Punjabi Kids Health. And so we launched initially with Punjabi speaking healthcare providers sharing children's health information. And at that point, it was some stuff on COVID, some things on virtual schooling, safety of vaccines in childhood and pregnancy, the topic that was on people's minds at that time, with regular updates of here's the latest on vaccines, here's the latest on distancing measures. And with that, we started to branch out because people were saying, hey, you know what, we love this. Was on Instagram and Facebook initially. And so at that point, Punjabi families in English and in Punjabi itself were following but asking questions that they didn't have the capacity to ask their primary healthcare providers. Either they didn't have one, which is a big issue in Canada, or they weren't able to see them in person because of all of the shutdowns and lockdowns that were happening. And so we were getting questions around everything from, how do I clip my baby's fingernails to how do I stop a nosebleed? How do I talk to my child about the death of an elderly person in our family or community? And so a really broad range of topics relating to, child and youth health, but also mental health, caregiver mental health as well. And so Punjabi Kids Health quickly grew to more than 100,000 people following that channel. And then we were able to get support and funding to be able to scale up this model. And so that was just over 2 years ago. We scaled up to a total of 10 cultural linguistic channels. So at this point, this Our Kids Health network that we've created has channels including Punjabi Kids Health, Tamil Kids Health, Mandarin Kids Health, Cantonese, Arabic, Ukrainian, Hispanic, Filipino, and then Black Kids Health as well. And we're hoping to continue to grow the family to be able to support even more communities. And all of our channels are bilingual except for Black Kids Health, which currently is in English. We're hoping to have a Black Francophone channel as well. But each of those channels then really hopes to honor the culture and priorities and values of each community, understanding that there are differences in how information may be taken in. And each of the channels has a visual identity where if you take a look at their Instagram or Facebook accounts, is very different from one another. And we've had those created by artists from each of those communities in terms of updating the logos and color palettes as well. And I think most importantly, it's the people behind each channel. So we have practitioners from each of those communities who are the on-screen faces who then share information across these different topics, and a coordinator from that community who's behind the scenes and listens closely to comments that we're getting to get a sense of, what's topical and relevant and what needs to be adapted so that it resonates with how people in those communities may be taking in health information and how it impacts how they participate in care. So that's really been the exciting part of our scale up. So over the last, I guess now 2 years, we were coming up to about 1 million followers across our different platforms. I don't like to use the term follower, which is such a social media term, because we're really community led. So we consider them members as a part of the network. So coming up to about 1 million people following. And then last year, our short form videos like Instagram Reels and our infographics had about 100 million views as well. So it's always just so exciting to hear from communities about what's on their minds, understanding that it's a dynamic process. But yeah, it's been really wonderful to watch this grow.
Yeah, I actually also, of course, took a look, and there's such a wide variety of topics about, like you said, anything from clipping nails of a baby to adolescent mental health to, what it's like to be a family. So identifying, cultural changes of families as well. I'm curious, can you tell me a little bit more, maybe just real quick, about the kind of providers that are leading these? Like who are these people?
It is a broad range, and I think so we're focusing on having people on screen who are regulated health professionals, and more broadly, we people who are trained and qualified in their space. So that could be physicians of different sorts. So we've got a handful of pediatricians, family docs, psychiatrists, nurses with different training backgrounds, midwives, early childhood educators, and teachers as well. We've got occupational therapists, dietitians. It's kind of like a whole team for each of these communities, and they are from coast to coast, so across the country, and some of them are in other countries as well. Some of our practitioners on the Ukrainian channel are in Ukraine recording these videos and sending them as well. Cool. So it's really a broad range, and I think part of that is we just wanted to also respect that different professionals have different areas of expertise, and there's so much wonderful knowledge to be gained from these different professionals. So yeah, we've got a whole cast and crew for each of the channels.
Well, and I, again, like pulling it into children's palliative care too, is so much of our work is interdisciplinary. And a lot of what helps our programs function is the fact that we have different people, different professionals doing different parts of work in order to care for the whole child and for the whole family. So again, it's just identifying that this child is a member of a family. And it sounds like a lot of this work is family focused. And so you need different professionals to speak into different parts of that care. And I just see so many parallels to that too, in terms of how children's palliative care programs run with different professionals doing different aspects of family care. And so I really do encourage people to go check it out. We will put the link in the show notes because there's some amazing stuff out there. I also noticed an Inuit group as well in there, and really looking at the whole trajectory of a child's life as well as the whole family and how that impacts each other. So can you just tell me a little bit about maybe what's next for you? Because I understand there is some work in children's palliative care that's on the horizon, which I'm very excited about.
Yeah, we're very excited. When we think about why we created Our Kids Health, it was really to make sure that as many people as possible have access to health information and they have the right to access that, including innovative models of care, including the latest and greatest in research. And, in speaking with our partners in pediatric palliative care, I think we're hearing more and more about how there's a disparity there in terms of who's accessing pediatric palliative care. And we really wanted to, so, we're partnering to create multilingual, multicultural, really resources that are going to be adapted with common questions that people have about pediatric palliative care. So some of those will roll out on our channels broadly around awareness, just so families know that this exists. And then also more specifically for families who are going through this process, common questions and things that may come up. And all of that information then will be, again, in infographics and short form videos with practitioners on screen who look like them and speak their language, where there's that more of an easier sort of built trust and rapport, as we've done across our other channels. But we're really excited to do that. So far, we're currently in summer 2025, trying to narrow down our list of topics of where we begin. And we're meeting with some wonderful partners with lived experience around, what do you wish you had known when you were going through this process? And with that, we also take that back then. So each of our channels, each of our cultural linguistic communities we serve has a community advisory board of their own. So those questions then go back to each of the community advisory boards around, how does this apply specifically to your cultural context? Or are there nuances or language that we could use to make this resonate more with people? And so that's going to be our next step as we kind of, generate some of what the content will be. And before we start recording, just making sure that we're on point in terms of how this should be communicated in a way that resonates with families and respects the way that they communicate and think.
Yeah, because I think that's a huge part of our work, again, in their understanding of their child's condition, but also what their community thinks about and understands about death and dying. That's so completely different in different communities and greatly impacts how you're accessing care, when and why you access care. So it's going to be really important for us to get. I love that there's a lived experience voice, and then obviously along with pediatric palliative care expert voices. And the platform in which you're using, I think, also is such a clear and easy way to access information. Now we know that accessing providers can be very difficult, but we know accessing the internet is very easy and low cost for a lot of people. There's ways to access it, even if there is, socioeconomic barriers and things like that too. So I see this platform as being hugely beneficial in a lot of different ways to address some of those issues. And I'm really excited to see where this goes. So I understand you're partnering with the Canadian Pediatric Palliative Care Alliance as well to do some of this work. Sounds like it's in its infancy. And so I think we're going to have to follow along and maybe check in another time in the future when maybe some of this stuff is starting to roll out and see where this project has gone. I'm really excited to see where this goes. What are you hopeful for in terms of children's palliative care when you roll this project out? What are you hopeful for?
I think we're hoping to create resources then that can give information, hopefully comfort and familiarity to families that are going through a difficult time, and where, again, they may be in a situation where it's difficult because of what their family's going through, but then also they may be, as I was saying earlier, feeling like they're in a system that they don't necessarily fit in with, or they may feel othered. And so we're hoping that these resources can help to bridge that gap for practitioners and for families. And what we're envisioning really is, these videos will be created, they'll have an online home, but can be easily loaded onto an iPad in a clinic setting where they can be shared with families, where they can just take their time and go through them, or they can access them on their phone at home and be able to go through these videos and infographics, be able to share them with other family members. As you were saying, Rachel, in many families, it's not, just one person making a decision, particularly during distressing times. So, if, we're hearing a lot about the role of, older siblings, of aunts and uncles, of grandparents, of religious leaders, as you were saying, right? So being able to have content that is easily shareable, that helps folks get on the same page in terms of how they're entering into conversations, maybe give families some language that they can use and to be able to converse with one another and with their healthcare providers around it. So that's really what our goal is with this in our partnership and in creating this to be able to help bridge that gap.
Yeah, I love too that earlier you said there's also going to be some really general information about children's palliative care and what that means. And there's always a need for what we would say is sensitization or trying to decrease stigma, which I know that majority of our families come to our world nervous, scared, distrustful, maybe like you say, like there's all different reasons why there's some hesitancy. And a lot of it is fear around the unknown. And what is this? What does it mean to be a part of a pediatric palliative care program? And there's a lot of stigma and fear around it too. So I also hope that there is some more general sensitization to what it means and how it can be helpful for families that have kids with medical complexities too.
Yeah. I mean, one of the questions, this is a bit of a spoiler, but one of the questions that we've been getting is, what is the role of the different team members?
Yeah.
Right. And that's something that it totally makes sense, right, as a question, especially when you're going through something, you've got a lot on your mind, you've got all of these folks who are there to help, but trying to figure out, who does what and how is this different maybe from other healthcare settings that I've been in as well. So I think we're really excited to be engaging, to be hearing from families these days right now who have lived experience and also from a cultural sort of expertise standpoint about how we can make this come to life.
This is some amazing work that you've done, and I recognize that this is really just in a short few years that you have managed to build this network, and it's pretty remarkable how fast and how far it's grown, and so I'm really excited to see where this goes next. So thank you very much, Ripu, for spending some time talking to us about it, and I think we're going to have to plan a check-in in the future with you again, have you back on and talk about the project once it gets rolling and off the ground. So we'll include the link, like I said. And so, for those that are interested, stay tuned. And there is a newsletter that goes out. So we'll make sure there's information about that for those that maybe want to stay in the know about what's happening here. And I wish you all the best with this next step in your project. Thank you very much for being here.
Thanks so much for having me.
Thank you for listening to this episode of the Sunflower Palliative Care Podcast. This unique series on equity in children's palliative care is produced in collaboration with Canada's Pediatric Palliative Care Alliance with support from Health Canada. The Sunflower Podcast grew from a seed of an idea as we talked with our colleagues in the Sunflower Children's Network. The Sunflower Children's Network is an initiative of Two Worlds Cancer Collaboration, which focuses on children's palliative care. We hope to build a world where no child suffers from serious health-related issues. To learn more, please visit twoworldscancer.ca.